Pharmacogenomics plays a significant role in drug selection and dosing by considering an individual's genetic variations that may impact their response to medications. Here are the key aspects of how pharmacogenomics is involved in drug selection and dosing. 1. Optimizing drug selection. Pharmacogenomic testing can help identify genetic variations that affect drug metabolism, drug targets, or drug transporters. This information enables clinicians to select medications that are more likely to be effective and well tolerated for individual patients. By considering a patient's genetic profile, healthcare providers can avoid medications that may be ineffective or associated with a higher risk of adverse effects. This personalized approach improves the chances of a successful treatment outcome. 2. Individualizing drug dosing. Genetic variations can influence drug metabolism, leading to differences in drug clearance and plasma concentrations. Pharmacogenomic testing can provide insights into the optimal dosage for an individual patient based on their genetic profile. This approach ensures that patients receive an appropriate drug dose that matches the specific metabolic capacity. It helps avoid suboptimal treatment responses due to underdosing or the risk of toxicity from excessive drug exposure. 3. Predicting treatment response. Pharmacogenomics can help predict an individual's response to specific medications. Genetic variations in drug targets or pathways can impact drug efficacy. By analyzing genetic markers associated with drug response, healthcare providers can identify patients who are more likely to benefit from a particular medication. This information aids in personalized treatment decisions and increases the likelihood of a positive treatment response. 4. Minimizing adverse drug reactions. Genetic variations can influence an individual's susceptibility to adverse drug reactions. Pharmacogenomic testing can identify patients who are at an increased risk of developing adverse events due to their genetic makeup. By avoiding medications associated with a higher risk of adverse reactions or adjusting the dosage based on genetic information, healthcare providers can minimize the occurrence of adverse drug reactions and enhance patient safety. 5. Guidance for polypharmacy. Pharmacogenomic testing can be particularly useful in patients who are taking multiple medications simultaneously, as it can help identify potential drug-drug interactions or variations in drug metabolism that could impact treatment outcomes. By considering an individual's genetic profile, healthcare providers can optimize drug combinations and dosages to reduce the risk of interactions and maximize therapeutic efficacy. It's important to note that while pharmacogenomic testing provides valuable information, it is typically used in conjunction with other clinical factors and guidelines when making treatment decisions. The integration of pharmacogenomics in drug selection and dosing aims to improve treatment outcomes, minimize adverse events, and enhance the overall safety and efficacy of medications for individual patients.